This is a story from the Be Kind to Pets Veterinary Stories. Dr. Sing Yen, BVMS, Glasgow. The old Jack Russell limps as she cannot put her right hind foot down. This is a case of a hip dislocation. This video shows surgical procedures. Viewer discretion is advised. On January 2, 2020, a 12-year-old female Jack Russell became lame suddenly. The lady owner consulted Vet 1, who took x-rays and confirmed right hip dislocation. Vet 1 referred her to a practice saying the surgery would cost $4,000 to $5,000. Vet 1 told her. Her husband remarked, "Why pay $4,000? Just put your dog to sleep." On January 3, 2020, the owner came to Topayo Vets. "Now that Vet 1's clinic is near my house," she told me, "I usually consult him. I do consult Dr. Daniel Singh recently." In 2020, there are nearly 100 vet clinics in Singapore. I understand perfectly that many owners will prefer proximity to save time and transport expenses. My physical examination showed right hip dislocation. "I need to take better quality x-rays," I said, "to see whether there are also femoral fractures." Vet 1's x-rays are as follows. X-ray from Vet 1 should be confined to the hip and knee areas. A better quality image is needed. And also you can see that there is a poor contrast. The femoral head area is not sharp. Topayo Vet's x-ray show no fractures in the surrounding right hip area. Arrow shows craniodorsal right hip dislocation. Vet 1's diagnosis of right hip dislocation was confirmed. "I work part-time and so I don't earn much." The owner was furious about her husband's remarks about euthanasia for her beloved dog. "I will never put my dog to sleep. I want her to be able to walk normally without limping in pain." Dr. Daniel Singh was her regular vet. He advised a non-surgical treatment using the Ehmer Sling. Although it has around 50% chance of success, it is a safer approach since the dog may die under anesthesia during surgery. If it does not work, femoral head excision surgery can then be performed. It is much less expensive. The owner consented. Dr. Daniel sedated the dog and put an Ehmer Sling which holds the femoral head into the socket as much as possible. First x-ray after Ehmer Sling shows the right hip is still dislocated. The dog is bandaged again. He repeated the Ehmer Sling again. It ensures that the femoral head is kept back into the hip joint to allow healing. The sling would be kept for around 2 to 4 weeks. The Ehmer Sling is a much less expensive treatment. It has around 50% chance of success. It is a safer approach since the 12-year-old dog may die under anesthesia if she is operated. If it does not work, femoral head osteotomy can be performed. FHO involves cutting off the femoral head and removing it. A false joint will be created and the dog can walk and run without obvious signs of limping. The common surgical treatment is femoral head osteotomy, also known as femoral head excision. Open reduction is indicated if there is a recurrence after closed reduction. An unstable joint is present, if there are avulsion fracture femoral head, or if there are other orthopedic conditions. On this picture, dislocated left femoral head is seen when muscles are parted by blunt dissection. The femoral head will be exposed more and cut using a bone cutter. On January 9, 2020, I was on duty. The couple came to bring the dog home after 7 days of inpatient confinement. I keep my fingers crossed for a feisty Jack Russell and hope that she will walk and sprint normally in 2 to 4 weeks' time. This is a Be Kind to Pets veterinary educational video sponsored by Topayo Vets. For more information, please visit topayovets.com. Thank you for watching.